Hollywood's elite transformed the Oscars red carpet into a spectacular fashion showcase as the film industry's most prestigious ceremony got underway. The glittering event saw A-list celebrities donning designer gowns and tailored suits, creating memorable moments that will define awards season fashion. Stars walked the iconic red carpet outside the venue, stopping for photographs and interviews before heading into the ceremony. The annual Academy Awards represents not just a celebration of cinematic achievement, but a global cultural phenomenon that influences fashion trends and generates billions in economic impact worldwide. Television audiences across dozens of countries tune in to witness both the glamour and the recognition of outstanding filmmaking talent. Tonight's ceremony promises to showcase the year's most celebrated performances while setting the stage for next year's Hollywood ambitions. Prime Minister Keir Starmer is preparing to unveil a comprehensive support package for households struggling with soaring heating oil costs across the United Kingdom. Families have experienced dramatic price increases since the outbreak of conflict between the U.S., Israel, and Iran, creating financial hardship for millions dependent on oil heating systems. The crisis has particularly impacted rural communities where heating oil remains the primary energy source for homes and businesses. Starmer's intervention comes as energy security emerges as a critical issue affecting not just Britain, but nations worldwide dependent on volatile oil markets. The escalating international tensions have disrupted supply chains and created uncertainty in global energy markets, forcing governments to reassess their energy independence strategies. This support plan could serve as a model for other countries grappling with similar energy affordability challenges as geopolitical conflicts continue reshaping the global energy landscape. American anti-abortion organizations are intensifying efforts to influence British reproductive rights policy, galvanized by the killing of activist Charlie Kirk in a campaign that spans across the Atlantic. These U.S.-based groups are working to challenge Britain's long-standing pro-choice consensus by funding local advocacy efforts and importing American-style activism strategies to the UK political landscape. The transatlantic movement represents a significant shift in how international advocacy networks operate, targeting countries with more liberal reproductive policies. Britain's historically stable pro-choice position now faces organized opposition backed by substantial American financial resources and established campaign methodologies. This development reflects broader trends in global reproductive rights debates, where national boundaries increasingly blur as advocacy groups seek international influence. The success or failure of this campaign could determine whether American-style polarization over abortion rights takes root in European democracies, potentially reshaping the global conversation around reproductive healthcare access and women's autonomy. A deadly meningitis outbreak in Canterbury has claimed 2 lives, including a university student, while 11 additional people remain seriously ill in local hospitals. Health authorities are working urgently to contain the spread of this dangerous bacterial infection that can cause rapid deterioration and death within hours of symptom onset. The Canterbury area outbreak has prompted immediate public health interventions, including contact tracing and preventive antibiotic treatments for those potentially exposed to the infection. Meningitis outbreaks in university settings pose particular risks due to close living quarters and social interactions that facilitate transmission among young adults. This incident highlights ongoing global challenges in preventing and controlling infectious disease outbreaks in educational institutions and densely populated communities. Health officials are monitoring the situation closely while implementing emergency protocols designed to prevent further transmission and ensure rapid treatment for anyone displaying symptoms of this life-threatening condition. Britain's patient watchdog is sounding alarm bells as growing numbers of people abandon NHS waiting lists in favor of private healthcare, creating what experts warn could become a dangerous 2-tier medical system. New polling data reveals a significant surge in private healthcare usage as patients seek to bypass increasingly lengthy delays for essential medical treatments and procedures. The trend represents a fundamental challenge to the NHS founding principle of healthcare free at the point of use, accessible to all regardless of financial circumstances. 11 people currently remain seriously ill while this healthcare crisis deepens across the United Kingdom. This shift toward private care reflects broader international trends where public healthcare systems struggle with resource constraints and growing demand from aging populations. The development could reshape British healthcare permanently, potentially undermining public support for the NHS, while creating greater health inequalities based on economic status rather than medical need.